Hello and welcome. I am Dr. Anil Joshi. Welcomes you to my series Learn Radiology with Dr. Anil Joshi. Today's topic is on MRI physics, that is also MRI coils. What are these MRI coils? MRI coils are the main component of the magnet. We are going to see what are the types of coils, where they are situated, how they function, and how they help us to get the best picture. So let's get going to the topic, that is the MRI coils, which are the main components of the MRI magnet. But not before we disclose, acknowledgement and disclaim. Most of the material in this lecture has come from our departmental routine teaching. We acknowledge with thanks those also from where we have got a royalty free material from web. With this brief disclosure, acknowledgement and disclaimers, let's get going to the main topic, that is the MRI magnet. The heart of the MRI machine are the magnets, and the magnets needs helium. So right from the basic, if we want to go, we have to learn from where helium comes, how it comes, and how it is filled. This is going to be very brief on this lecture. Now more detail we are going to cover magnetic coils. Now the imaging magnet is the most expensive component of the magnetic resonance imaging system, and most of the magnets are of superconducting type. Now they needs to be filled with helium. Now this helium is transported by the container, which are of 60 to 1000 liters capacity, different, and in that they are transported to the MRI centers. The typical volume of the liquid helium in MRI machine or MRI magnet is around 1700 liters. So that much helium is required to run every magnet. Now in early magnetic designs, the dever, that is the container in which you bring the helium, was typically surrounded by liquid nitrogen, and these devers act as the thermal buffer between the room temperature and the liquid helium. The latter magnets now designed, the liquid nitrogen region was replaced by a dever cooled by a cry cooler or a refrigerator. Now this also we are going to see in very brief in this lecture. There is a refrigerator outside the magnet with cooling lines going to the cold head. Now what is cold head, how it functions, we have covered it in some different lectures. So also the characteristic of helium, that is also in detail covered. Now in this lecture we are restricting ourselves to only coils. Now this design, that is the refrigerator outside, the need to add liquid nitrogen to the magnet and increase the liquid helium hold time to 3 to 4 years. Earlier days it was a very fast, every in experimental stage it was almost every third to fourth day, then it was postponed, and now it is up to 3 to 4 years. Now the shielding is achieved, this shielding achieved by a second set of superconducting windows outside the main one and with opposite current, which reduces the fringe field. Now these all we are going to see how a temperature of liquid helium is maintained in a dever. This is important for safety reasons and makes it easier to the site management. Now if you can see the MRI coil, see where are the coils are. One you are seeing important is a radio frequency coil, what is popularly called as RF coil. Then you have got a gradient coils, then you have got a main magnet, and you got a scanner which has got all these things. Now patient is supine in the tunnel, and below is a patient's table. Now you are seeing where the coils are. Now we'll see in more detail in cross section, in constituency, how these coils are. A coil consists of one or the more loops of conductive wires looped around a core of coil. Coils are a part of hardware of MRI machines and are used to create a magnetic field or to detect a change in magnetic field by voltage induced in the wire. So by changing it, you can change the magnetic field. Why it is required is in some other lecture we have covered. A coil is usually physically small It is like a small antenna. The perfect coil produces a uniform magnetic field without significant radiation. So this is another speciality or characteristic of a good coil. Now different type of MRI coils are used in MRI machines for different applications. Now gradient coils are used to produce a controlled variation in the main magnetic field. What is B0? It is magnetization around the long axis of the machine or where the patient lies, to provide a spatial localization of the signals and to apply reversal pulse in some imaging techniques. Now as far as MRI sequences are concerned, do visit our website for these. Now MR imaging radio frequency coils are there to receive and to transmit the RF signal. So bi-way work, receive also and send also. SHIM coils provide auxiliary magnetic field in order to compensate for the homogeneous in the main magnetic field. What does it mean? A magnetic field produced in the machine may or may not be uniform, may or may not be homogeneous. So who does that compensation work? Compensation is done by the SHIM coils. How it does it? Let's see subsequently. Now here what you are seeing are the main magnet, then you are seeing gradient coils, and then you are seeing RF coils. Now all these three has got their own roles to play, and unless all of them work properly, we don't get good quality pictures. So common MRI coils used in clinical practice are of these three types. Now how many of they are there, how they are situated, let's see them separately. SHIM coils, as we said, they improve homogeneity. So if it is not there, you will have to check the SHIM coils. Now gradient coils are main imaging coils. They have got strong magnetic field. Then are the RF coils. They transmit B1 field. So these are the different type of directions in which magnetic field is altered, and that is a topic of different lecture. Now the role of them is also to produce the signal and to receive them. Now let's see them one after another. Shimming coil. Shimming is a procedure to maintain B0 homogeneity. That technically the shimming word means chiseling in engineering, but here we are using it to make a coil homogeneous magnetic field. The homogeneous static magnetic field B0 is essential for acquisition of the high quality of data, and spatial resolution and symmetrical line shape are critical for reliable metabolite quantification. Where we do it? That is MR spectroscopy, where the metabolites are measured. Now B0 in homogeneous result primarily from susceptibility differences between air and tissues and are scaled with the field strength. One most commercial, in almost all the commercial scanner has got this type of coils. Continuing shimming coil, shimming routines. Its routes are reliably available and are typically performed by grading B0 magnetic field. So its main role is to produce a homogeneous magnetic field in B0 axis. Now rapid imaging techniques such as ecoplanar imaging or spiral imaging are often used to minimize scan time. You need a quick scan, in less time you want more information. So all MRI scanners have at least 3 coils available for shimming. Nearly they are in the axis of X, Y and Z gradient coils for imaging. The higher field strength, that is more than 3T Teslas, though they are not common, it is a future technology. So the magnetic strength is more than 3T. Higher order shimming is routine or is required because you need better quality picture. You do not want any artifacts to come. So you have to have second order shim coils to improve the performance because you are expecting accuracy more. Now come to the gradient coils. See X, Y, Z axis, there are 3 gradient coil. These are Y axis coil is yellow, then X axis is the blue and Z are the green colored. You can see the XYZ gradient coils. Now Three set of gradient coils are used in nearly all MR system, that is X, Y and Z gradients. Each coil set is driven by an independent power amplifier and creates a gradient field whose Z component varies nearly along the X, Y, Z directions respectively. The design of Z gradient is based on circular, that is the Maxwell coil. These are the names given to them, while the transverse X and Y gradient typically are saddle, that is Gowley coils. These are names given to them according to their configuration. The physical principles underlying these designs will be considered in subsequent lecture or in earlier lectures. Now, see how the coils are. Y are yellow, then transverse, that is the purple. You can see the patients. So green are the X, that is X-axis coils. So you got coils in X, Y and Z axis. See how they are aligned to the patient. When current is passed through these coils, a secondary magnetic field is created. The gradient field slightly distorts the main magnetic field in a predictable pattern. So you change it in a direction you want, causing the resonance frequency of the proton to vary, and this exactly is what you want. The primary function of gradient therefore is to allow spatial encoding of the MR signals, and how they are used in different sequences it is already covered in some other lectures. The gradient also are critical for a wide range of physiologic techniques such as MR angiography, diffusion and perfusion images. Applying a gradient coil frequency will cause a variation of proton dense position along the direction of the gradient. This change in frequency can be used for spatial encoding if gradient is played out during slice selection and again during the single readout. A slice can be selected perpendicular to the gradient direction. So that is how, by applying just in different techniques, you can achieve different goals. Now gradient coil, for example, if a Z gradient is turned on in this fashion, a transverse slice is created in a supine patients. Oblique slices can be obtained by turning on two or more gradients simultaneously. That's how you acquire a three-dimensional picture. A frequent misconception about the gradient field is that the X and Y gradients somehow skew shear the main B0 field transversely. So this is a frequent misconception, but it is not true. As I said, it is a misconception. Continuing, the X and Y gradients provide alignment in the Z direction to B0 field as a function of the left, right or anterior posterior location in the gantry. The X and Y gradients, ideally at least, do not produce subsequential component within the bore perpendicular to the B0, that is perpendicular to the patient's axis. Now within the magnet, the gradient coils for producing a gradient in B0 axis, X, Y and Z directions. What is done within the gradient coil? There is a RF coil. Now RF coil produces B1 magnetic field necessary to rotate the spin by 90 degrees, 180 degrees or any other value selected by the pulse sequences. Now let's come to the radio frequency, that is RF coils. Different coils we are seeing. Now let's come to RF coil. A coil is a large inductor with a condensable dimension in a defined wavelength, commonly used in configuration for MRI imaging. The frequency of the radio frequency coil is defined by the Lamar's relation. So these coils are top up for specific purposes. The imaging quality depend on the signal to noise ratio SNR of the acquired signals from the patient. So your aim will be to improve the signal and to reduce the noise so that SNR ratio will be better. Now several MR imaging coils are necessary to handle the diversity of the applications. Large coil have a large measurement field. So larger the coil you take, there has to be a large fit, but low signal intensity, and vice versa, because it depends on a coil diameter. If coil is too far, it will not have good signal at the target we want. And the closer the coil to the object, the stronger the signals. The smaller is the volume, higher is the SNR. So what we are achieving here is to reduce a distance and to capture the signals closer to the object, so that we'll get better SNR. Better signals will be better and noise will be less. Now SNR is very important in obtaining clear images of the human body. The shape of the coil depends on the image sampling. You are going close to the object. So how it should be designed? It should be designed according to the anatomical location or the position or the structure of the organ you are MRI or you are scanning. The best available homogeneity can be reached by choice of the appropriate coil type and correct coil positions. Both are important. Type of coil and position of coil, both are important, so that there will be proper contact, less distance between the anatomical part, and therefore coil should be perpendicular to the static magnetic field. So that also you have to take care how it is. The radio frequency signal is in the range of 10 to 100 megahertz. During a typical set of clinical measurements, the entire frequency spectrum of the interest is of order 10 kilohertz. This is an extremely narrow band, considering that the center frequency is about 100 megahertz. This allows the use of single frequency matching technique for the coil, because their inherent bandwidth always exceeds the image bandwidth. The multi-turn, solenoid, birdcage coils, single turn, solenoid and cell coils are typically operate as a transmitter and receiver of the operator signal. So whichever you are using, they will act as both to transmit and to receive. The surface and phase array coils are typically operated as a receiving coil only. Now, are there any other types? Yes, there are many types. MRI head coils and MRI brain coils are typically birdcage. They are available in all the machines. Then multi-channel coils allow the speed up, they increase the speed of a scanning with parallel imaging, particularly at 3T. So your magnet has to be powerful. Now the coils with 8 to 16 channel elements are commonly used in 3T, and that is why 3T gives you a better imaging. Now transmit receive coil with their low image noise are particularly useful for spectroscopic imaging technique. Multi-channel neurocoils enable to combine cervical spine, MRI brain, and MRI and neurovascular MRIs etc. Continuing on different types, MRI spine coils consist usually of a 15-phase array element with a lower number of channels. Knee MRI coils are usually volume coils. Multi-channel coils are designed for high SNR and parallel imaging. Transmit receiver quadrature coils are also available. Specialized extremity coils are built for high resolution images obtainable, for example, of the wrist, then for shoulder, for foot, for fingers etc. However, since the applications are not common, they are not available with all the machines, but in specialized center they are having these all things. Continuing, specialized magnetic coils. Dedicated bilateral based MRI coils provide better positioning and maximum access also for MR guided interventions. Now as you know, MR mammography, the technique is totally different. For that you need a different design of a coil, and accordingly they are designed, positioned, and patient is, the MRI is done in different positions so that good images can be obtained. An endorectal MRI coil is a RF coil used to obtain high quality images of the rectum area Where they are required in prostatic imaging and staging of the cancer, that is PIRADS classification. For general purpose, all manufacturers offer surface coils with different designs. For a high signal to noise ratio, so good signals, less noise, then faster image acquisition and patient's throughput is more if all these things are achieved properly. The body coil usually integrated in a whole body MRI system provides the possibility of image larger patients. So if patients are larger, not fitting with these coils, then you have to do with a machine magnet whatever available. Now look at this different type of coils for spine. First is cervical spine, second is lumbar and thoracic spine, then is knee joint, then is shoulder joint. You have got two types of shoulder joint coils, then there is a head coil, wrist and hand and ankle and foot for small parts. If you want to do good MSK work, these specialized coils for wrist and ankle are necessary. And as also I told you, for MR mammography, you need to have a specialized coil and technique. With that, we are coming to end of this short lecture. I thank you for giving me your valuable time. Please visit our website for comprehensive and detailed lecture over this topic and also many more. Thank you, goodbye and take care. See you again in next lecture. Till then, take care of yourself and patients.